News 2 at 4.
Hi, everyone. Welcome back to News 2 at 4. I'm Eric Egan.
And I'm Erica Francis. Some mixed news in our ongoing pandemic coverage on News 2. Tennessee is reporting 147 new deaths from the virus today, one of the biggest single-day totals. And Tennessee will likely break 10,000 total COVID deaths this week. Almost 2,200 new cases have been reported, but more than 3,800 patients have recently recovered. Good news, right? Well, thankfully, doctors say they're seeing light at the end of the tunnel. Hospitalizations across the state of Tennessee are drastically down for the first time since the surge started in November. News 2's Stassi Olmos is live for us from Vanderbilt University Medical Center to explain.
Well, that is right, Erica. We are seeing that drastic change. Now, hospitalizations hit their all-time high about a month ago, but now we're starting to see here at Vanderbilt, for example, they had opened an extra COVID-19 unit here, an overflow is what they call it. But as of this week, they've been able to close that unit and just focus on one COVID-19 unit. They say a light is at the end of the tunnel.
You know, we've been doing this for 10 or 11 months, and so we're tired and we're ready for it to be over. But I think there's some optimism in the fact that we're seeing lower numbers and the vaccines are starting to be distributed, and you know, we can start to really see the end of the tunnel.
Words of optimism from inside Nashville's busiest intensive care unit. Dr. Todd Rice at Vanderbilt Medical Center says they can see a glimmer of light at the end of this pandemic.
The big surge from the holidays, from the Thanksgiving, Christmas, New Year's, is sort of behind us.
Across the state of Tennessee, COVID-19 hospitalization rates are taking a dive, down more than 1,500 than their peak of 3,344 on January 6th. And in Nashville, a similar trend, down more than 300 from the peak on January 7th, nearly 100 hospital beds freeing up just this past weekend.
So I think it's just sort of better social distancing and masking, along with kind of some advancements in our understanding of the disease and some treatments in the vaccine.
Dr. Rice says there are a number of factors at play here. One, surges from holiday gatherings are ending as people are being more cautious. Two, vaccines are rolling out. And three, antibody treatments are helping high-risk patients leave the hospital sooner. While he says healthcare workers can see that light at the end of the tunnel, we're not out of this yet.
We will at some point get out of this and be at the point where we can be less on top of our game, but we're just not quite there yet. And so I think it's important for people to realize that even though there's a vaccine and people are taking the vaccine, we're still in a time period where doing the behavioral stuff like social distancing and wearing masks is still important.
Now, we are seeing this same trend across the United States, the lowest numbers since December 1st. But Erica, as you mentioned earlier, our death numbers are still pretty high. Now, we're going to see that because of the lag from infection date to hospitalization to those serious complications that can result in death. So those numbers are slowly going to go down. Reporting live here in Nashville, Stassi Olmos, News 2.
All right, very important. Stassi, thank you.